Hi, everyone. Welcome to High Pass. I'm Katie Patel, a pediatric emergency medicine physician and an undergraduate medical educator. Each episode is dedicating to helping medical students on their clerkships shine. I'm going straight to the source, to my friends and former classmates, to ask attendings in each field what impresses them and what sets their team up for success. Today I'm speaking with Rishabh, who graduated our medical school a few years after me. He's now an orthopedic trauma surgeon and will be talking
Thank you,
about how
Rishabh,
to
for
get
being
honors
with
in
me
ortho.
today. Could you introduce yourself to our med students?
Yeah, I'm Rishabh Jethanandani. I'm an orthopedic trauma surgeon. Did my residency in orthopedic surgery, and then did my fellowship in orthopedic trauma specifically.
Great, thank you. So I really want to pick your brain today because as a pediatrician, I have vague memories of my surgery clerkships and spending time in the OR, but I think that you're the best person to go to for just like kind of let me pick your brain about how can a medical student impress their ortho attending when they're really trying to go to a surgical specialty or even match into ortho ultimately. So just to start off, a little bit more about you. Like, what made you choose orthopedics? Were you always gung ho for ortho? Did you like fall in love as soon as you picked up a Bobby? Like, what's the situation?
I definitely felt like I it was probably something I was interested in probably as early as high school, but that doesn't mean that you can't get interested. I think it's like the best specialty ever. Um, I think the thing that I like about it is uh, I think it's especially in which you have so many ways to help patients for the better. In my particular specialty, there's patients that have very severe injuries that are limb and life threatening, and it is absolutely amazing being able to get them back to normal life. Like it is one of the craziest things seeing um, someone that's polytraumatized, has multiple injuries in the ICU, and then you see them in clinic just walking in like nothing ever happened. And that is something that happens quite often in orthopedic trauma. I think the other thing too is I like the technical work of it.
Mhm.
I think there's um, the the ranger work, at least in my area, it's a lot like construction, like you're putting a lot of pieces back together. For sports, it's kind of like minimally invasive surgery. So I think the technical work of it is like pretty interesting as well.
Yeah, that's really cool. I feel like you probably attract students that want to be in the OR, want to work with their hands, and then like want to see results
Yeah,
after they kind of like put their thought process to work.
yeah.
What do you think a student who isn't interested in orthopedics as their ultimate specialty, what do you think orthopedics could teach any medical student? Why should every med student rotate in orthopedics?
Well, besides it being the best specialty, I think something that you can learn from the specialty overall, regardless of what specialty you go into, is that I think that restoring patients' independence is one of the most important things for restoring their quality of life. So their ability to walk again, their ability to use their arm again, um, you know, just thinking about patients that are polytraumatized or hospitalized, helping them regain back early motion and early mobilization is a really important thing. And I think that also generally applies to other specialties where we may not necessarily always be doing life-saving measures, but they're something that significantly enhance their patient's ability to function independently.
Yeah. Yeah. Like I could imagine that in your conversations with your patients, when they're able to communicate with you, you probably spend a lot of time learning about like what's important to them, like on a day-to-day level
Yeah,
of what do I want to do with my day physically to be happy.
yeah,
And then you can kind of work on those goals. And that would definitely apply to almost every specialty.
yeah, absolutely.
Yeah. So let's say that we have a going to be third year medical student and they are either assigned to orthopedics or they are interested in orthopedics and selected to do a rotation. What do they need to make sure that they know about like topic wise before they set foot on that rotation?
I mean, I think overall, like as a group of surgeons, we're probably amongst the nicer ones, and we don't have crazily high expectations of
Mm,
what specific topics you should know. So in that sense, actually, there's not that much topic wise that they need to know perfectly or at all. But I think that for students that are not going into orthopedics, there's going to be almost no expectation to know anything other than anatomy.
mm,
And then
okay.
even then, if you get anatomy questions wrong, we're not going to be, difficult about it. We would ask those questions because we want there something to be learned from that.
Okay.
For people that are going into orthopedics, I think that the standards are going to be a little bit higher because we know that you're interested in that field. I think the my recommendation would be to think about the kinds of cases that you would be helping with as a medical student. So you have to think about if I'm a medical student, I'm probably going to be the second assist in probably one of two sets of cases. You're either going to be helping in joint replacement cases, and which fortunately they have the easiest job in the world. They just do two cases. So it's hip replacement and knee replacement. So they're going to be the second assist in that. So maybe watching some videos about that, or there's a website called OrthoBullets, which has it's good enough, I think, for most medical students to have a quick and dirty Wikipedia style understanding of what the procedures are. Um, and the other thing that they might help with is trauma cases, which is a little bit harder because it kind of involves different parts of the body. But I think overall the general advice of, you know, show up on time, don't complain about things, and, just, ask questions when it's appropriate, is fair, as unspecific as that might be.
I want to get to like the ortho bullets versus other references. So let's not
Yeah.
forget that point. But one thing that you brought up that I hear a lot of medical students talk about is this idea of like not being annoying in the operating room, right? Like knowing your audience, getting a read of the room, and not like asking questions just to ask them at awkward times and actually annoying your attending.
Yeah.
Is
Yeah.
there anything that you could tell someone before going into the room, or is that just something you have to feel out when you get there?
Yeah, I think, we all have sympathy for what it was like to be a medical student and
Yeah.
to not really feel like we know what's going on.
Mhm.
So I think that we almost always welcome questions, and I think it's hard to describe, but there's going to be certain times where it's going to be difficult to ask questions because we're focused on a particular thing. So if you can kind of like get a sense of the overall like tension of the room or whatever, that's probably not a good time to ask a question. But good times to ask questions are um, when the patient is undergoing anesthesia. Once the patient is asleep, between that and positioning the patient or something like that, that's a good time at the scrub sink. Closure is a great time to ask questions because that's a very you want to ask questions in low stress environments is the
Mhm.
overall thing. So try to think about times that would be low stress. So closure is a great time to ask about it. If the attending is going to go dictate the note or something like that, say, hey, I had a couple, questions about this. I was wondering if I could ask you about it after you're done dictating your note or something like that. That's a great time to ask it. You want to find those low pressure times to ask those questions.
Yeah. Okay. So like strike when the iron is cold.
Yeah, exactly. Yeah.
Yeah. And so I guess the other question that naturally comes up after that is like the pressure of like asking the right question. Like, is there a great type of question to ask your attending that makes them say, oh, wow, like, I love your question. You're thinking in an honors level student type way. Like, is there a high pass versus honors type question, or is it just the interest that you want to see in general?
Fortunately, it doesn't come down to asking questions per se. I think with surgery, the emphasis is really going to be on how helpful are you to the residents, uh, and how much does that translate into giving an honors kind of performance, essentially.
Mhm.
So within orthopedics, I think one of the hardest things that it was kind of a similar line of thinking where I was like, oh, I got to ask the right questions or I got to answer every question correctly and that sort of stuff.
Yeah.
It's actually the students that have stood out to me being on the other side don't necessarily have to say anything. Um, they are the ones that are there in the room early. They're helping set up the patient. Um, they are taking the patient to the recovery room. The best way I would kind of describe it is that your residency is not a very glamorous process, especially a surgical residency.
Sure. Yeah.
There's a lot of non-intellectual things that you need to do in order to kind of get through the day. So your goal as a medical student in order to get honors is to try to make your residence life easier
Mhm.
somehow. And um, it can be some really basic stuff like um, for instance, uh, getting in the room early and letting the resident know, hey, the patient just came into the room, or saying, um, I can I can text you when the patient rolls back so you can work on orders or, prep for the next case and that sort of stuff. Something a little bit more advanced in orthopedics is pulling up the imaging and just putting it up on the screen. Um, that would be a nice thing too. Another thing that really stands out is helping out with making sure that we have the stuff ready for the positioning and preparing of the patient. So, for instance, let's say you're doing an ankle fracture or something like that. You would need uh, something to elevate their leg, and you'd need a tourniquet, right? So those aren't things that are going to be super obvious to someone not doing orthopedics, but what you can do is ask the resident beforehand and say, hey, what stuff do you think we're going to need for positioning the patient? And because I can get those for you. Or if you can't, if you don't know where they are, you can ask a nurse and make sure that they are there, you know? So if you say, hey, we're doing this case next, what stuff do we need? I want to make sure it's there in the room. And then once the case is started, just generally helping with things. And then at the end of the case, helping close, helping taking the patient back to the recovery room, that sort of stuff. Those are ways to stand out. I think the way that I stood out as a medical student was how do I make the resident's life easier? That's how people stand out. Um, and you don't have to be the most charismatic. You don't have to be the most broy. You don't have to be anything like that. You just got to be the hardest person, the hardest working person in the room.
Yeah. So it's like you don't have to say the perfect thing, but you are carrying that patient from like pre-start to after finish. Like you're the team player that's going to make things go seamlessly.
Yeah, exactly.
Yeah.
And what's more is you can ask specifically and be like, hey, I want to make sure everything's ready in the room when you walk in. Like, what stuff do you need? And then you can just literally write that down.
Mhm.
And and ask the nurses like, hey, can we make sure we have this, this, and this or whatever?
Yeah, yeah. And I imagine that like you probably are involved in similar surgeries over the course of however many weeks you're rotating. So if you
Yeah.
have that list from day two and then you apply it on day 10, you probably look like someone who's invested in showing up and like having that continuity. And that would
Yeah.
be impressive.
Yeah, absolutely. Like if you just write on your notes like, okay, a knee replacement, this is the stuff we generally need or
Mhm.
whatever. And then that day 3 or 4, just say, hey, maybe the first day you ask, hey, what stuff do we need for this next case? I want to make sure everything's in the room when you walk in. Um, and then the second or third day, you can say, hey, this is the stuff I have. Can you just confirm like this is the stuff that I need? And I'll make sure it's in the room when you walk in. Because you have to imagine that as a resident, you have maybe 20, 25 minutes between when the patient goes to the recovery room and you go upstairs, you write your orders, you prepare for the next case, you come down. It's a very like hectic day for them. And if you can
Mhm.
make their day a little less hectic and kind of do a little of the grunt work that they would have to do if you didn't help them, they're going to be really happy with you.
Yeah, definitely. And so is it really just like the preparation, or is there any way a student can be helpful or then be impressive, like while the case is actually happening?
Sometimes when I have medical students come with me, I say, hey, and if they're in charge of suction, I just say, hey, if you can't see what's happening, I probably can't see what's happening either.
Mm,
So, um, just having that in mind, it's a little bit more advanced, but for people that are going into orthopedics, I guess you'll get a general sense of like if someone is struggling to see something or struggling to do something, maybe you say, hey, I can hold on to that retractor for you, or you know, hey, do you want me to suction here so you can see a little bit better or
okay.
change the light or something like that. That's a little bit more like harder to intuit, I think, but if they want to go for that, then yeah, they can, that's a way to help intraoperatively.
Yeah, that makes sense. And so I guess I want to go back to like the ortho bullets of it all because I feel like that is the number one reference that I remember hearing. Is there any reference or podcast or like go-to source that you like listening to on your way in or that you
Yeah.
usually go to hear like what's new and interesting that a med student would be able to look into or bring up in conversation that would be impressive?
Yeah, so there's an OrthoBullets podcast, for instance.
Okay.
Um,
That's convenient.
yeah, I think that the one thing that can be helpful is the day before, ask whichever resident, what room am I going to be assigned to? And they
Mhm.
can tell you you're going to be in the joints room or one of the two joints rooms, you're going to be in three knee replacements or something like that. And then on OrthoBullets, I'm going to check right now. There should be something that gives you the overall, steps essentially. What they should read about or know is how to do the approach, so which is the dissection down to the pertinent anatomy, and then
Okay.
the steps of the actual procedure. And there should
Yeah.
be something in there that says that goes over the basic steps, like what they're essentially doing. And then if not, I think it's totally valid to just literally go on YouTube and look up, you know, total knee replacement or something like that.
Okay.
There's
And
a
have like
million
one
videos
of
of it.
those residency programs that like walk through the steps.
Yeah, exactly.
Yeah.
For trauma, there's an approach. I guess the basics that the student should be kind of aware of, but we don't place like too high of an expectation of is the approach, which is how to get down to the relevant anatomy, and there
Okay.
should be some sort of video on that. And you can, in the worst case scenario, you can ask the resident, say, "Hey, what I want to read about the approach we're using. What approach do you think we're likely going to use?" And then you can read about it. Additionally, there's a book called Hoppenfeld's Surgical Exposures in Orthopedics,
Mm,
and it's broken down by like anatomy. So say like knee, shoulder, that sort of stuff. And actually, there is something in there that should say this approach is used commonly for this surgery or something like
oh,
that.
great.
So that's a way to figure it out. And then for the actual procedure itself, it it would require a little bit too much for us to expect all the little details of how to put
Yeah.
things together and that sort of stuff. But if they watch a general video about it, I think, that should be fine.
Okay, got it. And then maybe like this student that's like super interested, really wanting to go into ortho might be able to use like the other steps to kind of come up with some questions of where they might want to like talk to their resident about, or do you think that they wouldn't even need to go there?
I felt like when I was a med student, I felt like I had to prove that I knew what I was, talking about or that
Yeah,
I
yeah.
was knowledgeable about it. It's a little bit less so. Like in surgery, it's a lot more about just being a hard worker and uh, helping make other people's lives easier. That's you can I don't want to say you can know nothing and be a really hard worker and be like a clear honors candidate, but there's people who have stood out to me who have not said like more than a couple sentences. There are people that stand out by just working hard, as
Mhm.
tough as that might, sound to hear. So,
No, I mean, I feel like there's like something similar that I felt during pediatrics. I remember like in residency, we used to say, like, I can teach you the medicine, but I can't really teach you to like show up and care. And so it seems like that's actually more applicable to like all specialties. It's really about like showing up and like showing interest in more ways than just asking the perfect question. It's about being the team player and planning ahead and trying to think about how you would like fit into this team that you want to join.
yeah.
And I think it also like can decrease some of the pressure too, especially with these surgical subspecialties. They seem so like not the next step, like the next step in your training. And so that can be really daunting. Um, Especially when you're not like used to studying or thinking about those procedures. So I feel like this actually takes some of the pressure off and you could really be a team player and really stand out, which I think is great to hear. If I imagine if I were a third year medical student trying to go for a surgical subspecialty. And so I guess like, is there a counterpart to that? Like, do you find that there's like a common mistake that medical students do? Like, let's say that they're like trying to help out, or maybe they're not, maybe they're just kind of floundering. Is there like a common thing that you see come up in ortho that you find yourself having to give like the same theme of feedback to students, or does it not really boil down to that?
I think what they need to hear is reassurance that like we will make time for teaching when the iron is cold, you know? I think the only time where I get a little bit annoyed is like, let's say there's something that requires a help of a medical student or of a second person, and it's usually really basic stuff like moving a patient over from the stretcher onto the operating room table, or
Mhm.
moving from the operating table back to the stretcher, or positioning the patient for surgery. If I'm waiting for someone else, my second assist, usually my medical student, to help me, then I'm gonna get annoyed, because we're we're waiting on you to get this thing done. Fortunately, I think it's less likely that that
Yeah.
happens.
I wanted to ask, like, what is the best piece of advice that you think you received personally?
A good chunk of your training is going to be your responsibility. So there's going to be a set amount of, basic training that you get across your specialty, right? But in order for you to be really successful, you do have to go the extra mile in order to and seek out opportunities in order for you to get your education. So I guess the short way I would say that is you are ultimately responsible for your education and training. So if if you feel like you want to get more exposure to a particular surgery or a particular specialty or something like that, uh, you should make the effort to come in on the weekends, stay late to do those cases, um, reach out to people and, go to courses, and that sort of stuff. Whatever specialty you want to do, um, you have to make the extra effort in order for you to be really good at what you do.
Then, as you're thinking of where you do want to go to residency, that having those opportunities or being mindful of how that residency works will also be really important to see if you are matching into the right program where you not only align with the people, but you also align with like the process of how things go.
Yeah.
And I didn't realize that until I think I was doing away rotations as a fourth year when I started seeing that there were like different patterns in different programs. And I got advice from like a senior resident about like, hey, if you're interviewing at all these different pediatric programs, you're going to want to ask this question. And it kind of like boiled down to how you were learning about your patients. Do
Yeah.
you think that there is something, a takeaway or a certain question or theme that medical students that are applying in orthopedics should make sure that they ask the programs that they're interviewing at?
Yeah, absolutely. And I think it's a question that should be asked carefully. Because you don't want to seem like and I think most people are tactful enough to figure out like how to ask it, but you do
Yeah.
want to ask about how much autonomy you have in the operating room.
Okay. Yeah.
And I think a big chunk of that is based on how much volume there is and what kind of cases come in. So I think for people interested in applying for orthopedics, you want to find a program with a good trauma experience. And the reason why you need to do that is that trauma is that was kind of the origin for orthopedics and kind of the basis. Um, and it allows you exposure to, everywhere else in the body. So, if you can be a good traumatologist, then you're going to have, good skills for foot and ankle or shoulder elbow or, hand surgery or whatever.
Mhm.
So, trying to find a program with a heavy trauma volume and experience is going to set you up well because those generally are the the programs where you're going to be operating a lot, doing a lot, and seeing a lot essentially. You'll get a sense when you're scrubbing into those cases, be critical and see how much is the attending doing and how much is the resident doing. It it should be carefully asked with the right person what the autonomy level is like. That's something that's probably more observed or asked of from people that you trust and know.
Yeah. Okay, that makes sense. Awesome. Well, Rishabh, thank you. I feel like you have provided a lot of really great expertise and insight into the world of ortho for us. Any last parting words before we wrap up today?
Um, I just want to emphasize like we all remember as in orthopedics, we remember what it was like to be a medical student and we recognize that orthopedics is not a core portion of instruction in medical school. So, we're going to be understanding. We want you to, have fun, work hard and have a good experience. And I think it's going to be regardless of what you're interested in, you're going to have a good time on your ortho rotation.
Great. Awesome. Well, thank you so much for your time. I really appreciate it.
Yeah, of course.